Hi guys, my name is Tenzin Dechen. I'm a nurse practitioner currently practicing in internal medicine. I've been a nurse practitioner for almost 4 years now, and I have been a nurse for over 8 years. I went to nursing school at Widener University and also nurse practitioner school as well in Widener University. I decided to take on DNP program from Widener as well. For my DNP project, I have decided to research complementary and integrative health for chronic pain. The reason why I chose this topic is because complementary and integrative health is an evolving topic. Most of the patients I work with experience chronic pain. And due to the current pandemic, I've also experienced many patients coming in my office for anxiety and depression. Complementary and integrative health can alleviate this, and it's not just meant for chronic pain. I've been using complementary and integrative health with my own patients more and more now. I've been receiving a lot of positive feedback from my patients. I thought I would take this opportunity to help other future providers and current providers become more informed regarding information on complementary and integrative health. So let's begin our module here. Our first module is an introduction to complementary and integrative health. The significance of this clinical topic is that there is a gap in evidence-based research on complementary and integrative health. Therefore, in order to bridge the gap, the purpose of this DNP project is to design, implement, and evaluate an evidence-based complementary and integrative health educational model for pain management. PICO question. For my PICO question, does evidence-based complementary and integrative health education for advanced practice nursing students influence intention to use complementary and integrative modalities in practice compared to traditional pain management? The critical appraisal for the evidence involve using database such as Cochrane, PubMed, CINAHL, and various academic journals that I found using Widener's online library. Together, 10 useful articles were found after going through a process of elimination. Based on a PowerPoint slide here, there seems to be an indication of a high level of evidence, which is level 1 and level 2, being 6 articles out of 10. This was the process of elimination in choosing the right article for the project. From 8,817 articles originally found, only 10 were found to be useful for this project. And this article, this slideshow show you the breakdown of the 10 useful articles. It also reveals the complementary and integrative modalities being used. So these are the objectives we are trying to achieve in Module 1. So students, upon completion of this module, you will be able to describe the standard practice for chronic pain, critique the underlying issues surrounding substance abuse disorder, examine evidence on substance abuse and complementary and integrative health for treating chronic pain, define the prescription drug monitoring program, which is PDMP. The current standard practice for treating chronic pain had generally been opioid prescription. The data reveals that from 1999 to 2011, there had been an increase of 139 million opioids that were dispensed. Along with that, the overdose death related to opioid were 35% attributed to opioids in 2017. So let's test your knowledge. I'm going to ask you pre-assessment question. Question number 1, what is the percentage of older patient ages 57 to 85 years that use at least one prescription medication on a daily basis? A, 50%, B, 65%, C, 80%. I'll give you a few seconds here to answer. The answer is 80%. Question number 2. People of any age, income, education level, and gender can abuse prescription medicine. However, educationally, economically, and environmentally disadvantaged populations have disproportionate higher risk. True or false? True. Question 3, the misuse of prescription drugs is highest among younger adults. What age range possess the highest risk for the misuse of prescription drugs? A, 12 to 17, B, 18 to 25, C, 26 to 35. The answer is C, 26 to 35 years old. Question number 4. Meditation assists patients with lowering their pain significant levels. True or false? True. Evidence has shown that meditation does help with pain. So here are the backgrounds that I have here. So Pennsylvania alone has one of the highest rate of drug overdose with a total of 4,415 deaths in 2018. According to the CDC, within the 10-year time span, 2008-2018, in the US, prescribing rate had come down. The total number of prescription went from 237 million in 2008 to approximately 168 million in 2018. And the prescribing rate per 100% went from 78 to 51.4% in 2018. The background of this clinical issue is that even though health organizations and healthcare providers have reduced the number of opioid prescription from programs such as PDMP and requirement to maintain continuing education unit related to opioid prescription, opioids still present a real risk versus complementary and integrative modalities, which are safer options. It seems that the current climate on dealing with opioid usage is to limit opioid. However, this seems to also miss the root cause of why patients use opioid in the first place, which is to deal with their chronic pain and misses focusing on safer treatment option. Some important points. Even though there are a lot of evidence-based articles on complementary and integrative health, it hasn't been used enough because most providers do not recognize complementary and integrative health as their first option. So there are steps in reducing substance abuse. PDMP stands for Prescription Drug Monitoring Program. It went live on August 25, 2016. This has been used as a primary source of for providers to discover any suspicious activities. Overall, PDMP helps avoid improper prescribing, and about 49 states have implemented PDMP, with the exception of Missouri. So one of the evidence-based article is discussed here. Chronic pain treatment have direct and indirect cause. Example, treatment expense, absenteeism, depression, addiction, and recidivism. Treatments have largely been pharmacological, with opioid increasingly used for non-cancerous chronic pain. Opioids are still overprescribed, although the numbers have decreased since 2012. There were still over 191 million opioid prescriptions dispensed in 2017 alone. The combined implementation of pain clinical policies and mandatory PDMP review had revealed an 8% decrease in opioid prescribing and 12% decrease in opioid overdose death. This is promising, but we still have a lot more to do. Evidence-based alternative therapies for chronic pain, and these are the therapies: physical therapy, chiropractor, acupuncture, massage, yoga, aromatherapy. So I have a storyboard example here. Jane, DNP, has been prescribing Percocet and Xanax for patient with a back pain. Patient have told their friends. Jane NP is under tremendous pressure and finds herself now prescribing opioids upon patient request as her management approach to chronic pain. What are the potential penalties for non-judicious prescribing of controlled substance? What are Jane NP other pain management option? Penalty to provider could be potentially losing their license, and penalty for a patient involves causing harm to themselves. Therefore, it is very important to have understanding of pain management, and it is okay to say no to a patient sometimes, not feel pressured. So I have a couple of storyboard analysis here. Number one is, this is Linda. So Linda has been complaining of chronic pain and was prescribed pain medications by her primary care provider. However, Linda relates to her provider and that she wants to try alternative therapy. And which of the following would you recommend? Provide Linda with educational clinical materials on opioid. Inform Linda that integrative medicine may be more effective treatment for her. C, follow clinical guideline. D, all of the above. I would say all of the above. And here is the rationale. Storyboard 2, this is Lisa. Lisa is 50-year-old Native American female who is on Percocet for many years due to severe osteoarthritis in her knees. She's in the office for medication refill. Her provider checks PDMP and finds that she's indeed due for her medication, but in 2 days. Before writing prescription, the provider obtained urine sample for drugs. Urine sample showed that she does not have Percocet in her urine, which is a suspicious action. What should provider do next? So which of the following should providers say to Lisa? A, unfortunately, due to strict contract policy, I cannot prescribe you the Percocet today. B, discuss alternative medicine treatment. C, refer Lisa to orthopedic surgeon for possibly knee replacement that will fix her pain. D, all of the above. I'll give you a few seconds here. Okay, the answer is all of the above. So storyboard 3 is Will. Will's primary provider retired after 40 years of practicing. We do see a lot of patients now the pandemic force a lot of providers to retire early. We are seeing this more and more in my practice. So NP Nisha was assigned to Will as his primary care provider. However, Will has a medication list consisting of many controlled substances, um, including Lyrica, gabapentin, Percocet, Xanax, Ambien. Although gabapentin is not controlled substance, it can cause a lot of damage when combined with all the other medication that's listed here. So NP Nisha noticed that he's on various controlled substances which are not safe for him and not the best practice. When confronted, Will became very upset and pressured NP Nisha to order the medication for him. Nisha gave in and ordered just to please Will. Will eventually overdosed on his medication and passed away in his sleep. Will's family is very upset with NP Nisha for giving him that many controlled substance and threatened to file a complaint. What would you do if you are NP Nisha? Prescribe Will's medication as he was already on them. B. Check PDMP and discuss weaning off his medications. C. Stop Will Xanax and Ambien. D. All the above. I would do B. Check PDMP and discuss weaning off his medication. So you don't want to stop Xanax and Ambien completely, as it can cause withdrawal symptoms, especially with Xanax. So the best thing here to do for Will is to check PDMP and discuss weaning off and possibly referring him to a specialist. So here are my references. Thank you so much for doing this module with me. And don't forget, there will be another module to follow this, and also evaluation form for extra credit from Dr. Gray. So thank you so much. Bye-bye.